Are we good?
We're good.
Okay. Are we a little tilted? Do you have a thing on it? Is there a level on it?
Yeah, but the level's not level with.
The level? That looks right. That looks
You
great.
don't mind shut that door too. Thank you.
I should have learned this by now. You need to give me a reward for this, then I will always remember.
See, yeah, right.
Positive reinforcement.
I just don't want to get bothered. Sometimes you got people coming down the hall and they'll yell and scream, not even knowing that we're recording, and so.
Yes, you're right.
All right, here we go. Let's see.
They used to call depression melancholy, right?
Let's see. You're going to
Yeah.
use that mic, and you're going to use that mic. Okay.
Melancholia.
Melancholia.
So let's.
Melancholia, which means loneliness. Melancholy.
Good. Okay. Good. Here we go. And away we go. Dun, 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 dun. Okay.
Does this dial?
Friday mornings,
into
tune
the-
in. The Healing Docs want you healthy.
He can hear you.
Yeah, the Healing Docs do want you healthy. That's why they're in the studio every single week for you. And of course, with several offices to assist you, then they're all around the area for you, waiting on your call, waiting for that appointment to see you in their office on Mariner Boulevard in Spring Hill, on Ridge Road in Port Richey, or on East Bush Boulevard in Tampa. 3 offices the Healthy Docs want to get you into. Absolute Healthcare, 352-251-0000, the number, or go online, make that appointment there at absolutehealthcare.org. That's right, absolutehealthcare.org. And we're talking about the Healthy Docs in our studio, bringing up the information and educating us on the issues that matter most to you in your health to make you healthy. The Healthy Docs, of course, Dr. Malhotra, aka Dr. G, and Dr. Gupta in the house once again to bring that information right there to you. So without further ado, I'm going to turn it over to them now. We talked about certain issues over the past. This one deals with most all of us at one point or another in our lifetime. I hope it hasn't taken effect to the point to where you can't live your life, but some people do deal with depression in certain ways, and we're going to talk about depression today on the Healthy Docs show. So without further ado, once again, turn it over to Dr. G, Dr. Gupta. Good morning, gentlemen, and welcome.
Good morning, John.
So depression, what's the percentage that of Americans does depression affect?
Look at that. Yeah. It's about 10 to 15% of Americans have
Okay.
diagnosed depression.
Diagnosed depression, okay, but as far as depression in
So-
general,
I think it must be a whole lot more because many people think that their moods are okay, but they're still performing under their peak performance, what they're capable of.
right.
And they're still under enjoying their surroundings because, when I look at America, I feel this is paradise. And if people don't feel that, I think I want them to be at that point where they feel that they are in the best place on the planet.
So, like, if it's hard to get up out of bed in the morning, if it's hard to socialize, if you just don't want to leave the couch or leave the home because you just have those feelings, what exactly is depression?
Well, it's actually a good point that you brought up that we should actually define what medical major depressive disorder really is and differentiate that between just a down mood, feeling sad. So it's really when it's more days than not over the course of usually at least 2 weeks, but sometimes more often than not, it's much longer, of feeling those symptoms of sadness, depression, decreased wanting to actually do anything they used to enjoy, and guilt, all of these things that sort of follow that cloud over your head that we've mentioned in the past that really define what major depressive disorder is.
Without having a catastrophe in your life.
Exactly.
Without any good reason to be depressed. So if you start to have those things that stay on, it's persistent low mood.
Mm-hmm.
That is what I would just put in a nutshell is depression.
Yes.
And then of course we have many ways of diagnosing it and quantifying it and stuff like that.
And that's the thing, because everybody has moods. So happy moods, sad moods, anxious moods, stressful moods. So that's part of life. You're going to have those moods come and go. It's really when one mood is predominant that we start to say, is there a true mental disease going on here, or is it just a mood? Because everyone's going to be going through them. And that's why we want patients to bring things up to us and not either oversell or undersell their symptoms. Some people say, I don't have anything going on at all. I feel fine, I feel great. But there are other signs or symptoms, either their loved one is in the room with them saying, the complete opposite, or the other end of the spectrum where a patient saying that everything is wrong, everything is off, and it's hard to get an idea of how severe the disease really is. So it's really important to be open and honest with us and trust us so that we can get a true diagnosis, because you don't need blood work, you don't need a test. Yes, we do general blood work to make sure there isn't some other condition that can make you depressed or lead to more depressed mood, but otherwise you don't need a special test or pictures. We can just find out what's going on right there in the office.
Yeah, we just talk. Have some specified questions sometimes. Sometimes just talking to the person, you realize that he is not enjoying his life. Everything is good in his life and he is not happy. So just small things, of course, we objectively go ahead and quantify it and then say, this is the position where we are. Our tools tell us that this is where your emotional situation is, and you could be performing way better and enjoying way more. So allow us to help you.
Clinically diagnosed depression, is that a mental disease?
Yes,
Oh.
it's a mental disease, just like many other mental diseases that we've talked about.
Like any disease.
Yeah.
I have
Right.
knee pain, it's a disease.
Sure.
I have elbow pain, it's a disease. I get a headache, it's a disease.
Okay.
So in that sense, it is a disease. But it's nothing to be saying, man, oh, I've got something unusual. You really have something that is so common. So come forth with it. If you can take care of your knee with a doctor, why not come forth and say, hey, my mood?
Yeah.
Because it affects everything and not just your leg. So I may not be, the connotation of the word disease sometimes can be negative,
Right.
but it's not. It's just part of life.
Yeah.
Yes, you can get it. Let's take care of it.
Is it mainly a hidden disease?
It can be.
Yeah.
Unless expressed.
Okay.
Plus, people tend to hide themselves. They
Right.
don't want to be social, like you said.
Yeah.
They don't want to get out of bed. So, yes, somebody else, a family member, might see it and say, hey, son, what are you doing? The sun is up. Let's get out there. Let's go for a walk. It's the weekend. Are you doing anything? And the poor child or the adult or the senior is in that position where they just don't feel like doing anything. So, it could be hidden unless brought forward to a doctor and expressed. And we at our office screen each and every individual who comes to our office at least once a year for this hidden problem, which can be hidden. Sometimes many people are forthcoming and say, yes, hey, I have this there. I've recognized it and I appreciate it. We all say, solid. Let's go ahead and fix the problem.
And another thing is that when we were looking into some of the numbers, that most patients with depression go to their primary care doctor first.
Oh, good.
So we really are at the front lines.
Yes.
And a lot of the times, up to half of the people that would have a diagnosis of depression don't get the diagnosis because they're either not being screened for, but it could also be coming from the patient where they're not being forthcoming or wanting to talk about it, feel ashamed or embarrassed to bring it up. But it also is something that we want all the doctors to do, because it's not just the psychiatrists that see these generalized anxiety and major depressive disorders. We're usually there first.
So important, that
Yeah.
point. Because you try and make an appointment with a psychiatrist, you've got a 6-month wait. For those 6 months, your condition may deteriorate. Winter will come and you will feel more depressed. So all these things are important that, hey, you have access to your family doctor, take advantage of it. So, great point there, Doc.
Yeah, I agree with that 100%. I like that. You're on the front lines, as you say, and the healthy docs are on the front lines to
The
make
first
you healthy.
contact. It might be
Yeah.
the only contact.
Right, sure, that's
Yes.
right. So let's say it is a hidden disease and somebody just doesn't quite recognize the symptoms. What can they look for?
So a lot of things actually are part of the syndrome of major depressive disorder. There's things like difficulty concentrating, difficulty recalling facts or memories, just noting that they're not doing the things that they like to do. They used to like a sport, they used to like a video game, they used to watch a television show, read the newspaper, whatever it is. So you can see that they're not doing it as much anymore. Maybe they're oversleeping or not sleeping much at all. So there's a lot of different things that you can see that are not sort of your classic I just feel sad sort of state of mind that can lead you to a point to say, I think there's something wrong here. And that's either something you can bring up to the doctor or say, you know, I see you, you know, for the past few years, and something I feel as my own gut feeling, something's off. And I say, would you mind having one of your family members sit with you and discuss some of this? And if they're willing and open to do that, then I'd like to hear the other points of view from their outside of the clinic life. And that can help us really get those hidden diagnoses.
Yeah, if the patient is not forthcoming with it in that situation. Otherwise, the patient's 9 times out of 10, the patient himself, herself is in agreement with what we already know is happening. It's rarely that we have to say, let's get a family member, let me talk to your wife as well, or let me talk to your husband as well and see what's going on. And of course, with the permission of the patient, if the patient is uncomfortable with that, we would never do so.
Right.
Unless we feel that the patient is a threat to his or her own life or somebody else's life, we would never break that trust and the relationship that we have with the patient.
Yeah, 10-4. And when you talk about moods, is that the same thing as expression? I mean, or what would you classify moods as?
So one thing that we talk about is mood and affect.
Okay.
So the mood is somebody telling you how they feel, and the affect is what you see them actually displaying, right? So if they're congruent is what we call it, if they're actually the same, so
That's
someone looks happy and they say they're happy, then that's a congruent mood and affect. So when those don't align up, something can be off. So we have to do exploration of, that's part of our physical exam. We actually are seeing this in the office with our own eyes, and we are actually watching the way that they talk, the way that they're moving their arms or their hands, the way they're avoiding eye contact, whatever it is that you can see that's different than maybe before or not typical of a person in a room with you. So you can find these different things with someone's mood.
Interesting. So emotions would play a big part of that.
Yes.
Correct. You know, when a patient's in a room, you joke with them, you meet with them.
Yeah.
It's a nice social environment that they can express themselves, you can express yourself. And if that interaction is not what you expect, let's say Dr. Gupta might crack a joke in the room, and if the patient does not have that expected impact of that statement, then he will start to think that maybe there is something going on. You know, just because the humor, sense of humor doesn't match is not all.
Right.
But if it constantly is that there is an underlying, you know, sadness or anger or avoidance, then we start to go further and say, you know, something's up and we can make your life better.
I love going further, digging deeper, and that's what the Healthy Docs do at Absolute Healthcare. We love that. As far as our environment, foods, I mean, I assume that our environment would affect our mood on a daily basis even, but as far as foods are concerned, does that affect our moods as well?
Yes, I think food is a major part of our mood. Our environment, our foods, the things that we do, sedentary lifestyles, major obesity, you know, not getting enough or good sleep. So all of these things are going to be a holistic factor that plays an important role to your overall depression, anxiety, stress levels, all of those things. So we don't just focus on those things, and we've mentioned multiple times the different aspects of a person's life that we want to focus on. Their sexual, mental, their social, financial. So those are all of the factors that are important to say, okay, if every other factor was strong besides their mental, we could make a huge impact on the mental alone before we even get to say the point of let's do a medicine or let's do a therapy. So we want every part of their life to be strong, because it really is like a person with 2 legs where you need both legs to stand up. So if you have a good foundation of everything else, then you're in the best position to be successful with the treatment.
And that would include their diet as well. And we believe that what is good for the body is good for the mind. So Mediterranean diets are diets that will make you happier. Unhealthy diets filled with fat, low on protein are going to make you more sad. High protein diets are going to make you happier. So choosing foods is an important aspect of remaining healthy in multiple ways, not just physically, but emotionally as well.
So it's not just all in the brain or mind, it's the body as well.
Absolutely.
And you connect those dots there at Absolute Healthcare. That's what we love so much about Absolute Healthcare and the healthy docs that make their way into the studio each and every week. Absolute Healthcare online at absolutehealthcare.org. How about where we live? We talked a little bit about environment, but our workplace can be stressful. There could be anxiety. How does that affect our mood, and how do we compare that with our depression?
So I find Dr. Gupta is very depressed at work.
I'm certainly not a comedian, though.
He is a comedian.
Yeah,
He
yeah.
just has a great time. I think we all have a great time at our workplace.
Uh-huh.
We have a beautiful staff that is supporting and caring and loving. And there are times when you feel that, oh, I want to get out of the stress of work, of home sometimes, to go to work.
True.
I say, I'm going to go work and de-stress. And then I'll go home and take my family again.
Yeah,
You know?
yeah.
So I think if you have a bad situation, no matter whether it's home or is work or is political or is racial or whatever, community, you're going to be depressed. Your surrounds impact you. Your friends, are your friends happy people? Are your friends people who just want to drink? Or are they people who are really interested in you? So, this is how we create an environment that is supportive in the right way to create a wonderful foundation and the entire structure. If one thinks of one's life as a building, you start at the foundation, but make sure you leave nothing weak, and everything will be beautiful.
Speaking of workplace, it reminds me of a movie. I don't know if you've ever seen Joe versus the Volcano or not, but he walks into the same job every single day, and the
Yes.
lights are flickering. There's just these fluorescent lamps. It's dark, it's musty, it's wet and moldy, and it's like he gets depressed. Anyway, so the workplace can affect your mood, and if it is affecting your mood, maybe you need to be that person to stand up or to seek another workplace, whatever the case may be, because depression is a serious disease.
Impacts everything in life.
Yeah.
Your social life, your financial life, you won't perform. Your entire career could be destroyed if you don't take care of it.
And speaking of social life, have we seen the numbers increase ever since the social apps on the internet or the internet itself? Because you hear a lot of bullying, that may cause depression,
It certainly does.
a lot of seclusion.
Higher screen time is associated with higher depression.
Okay.
So, the good old times when all of us would socialize and meet and say, let's meet up for lunch or just for tea or coffee,
Yeah.
those things have gone away.
Mm-hmm.
COVID impacted that even further. And here we are coming out of it. Hopefully, we'll all rebound and do a much better job about socializing and put our screens aside and meet with each other in reality.
Yeah.
So just like touching each other, just understanding that I'm here for you. Or me feeling like that. He never does that to me. I don't know why. Maybe he's not there. Oh, me.
A good pat on the back helps.
But this is that we are here for each other. Just like you would hug your child or your friend or your family, that social connection is so important. And the environment, I think what you said is totally right, that we need to get out of these screen times and stuff
Yeah.
and become real people.
Mm-hmm.
And they have some campaigns, public service campaigns, where they say, have a device-free dinner, things like that. So where you turn your internet off from 5 p.m. to 6 p.m. and at least one part of the day when you're with your family at the dinner table, there's no distraction. So there are things like that are already being recognized as a problem.
Yeah.
So I do think that it is important to limit the use of phones and screens. For example, you go to a fancy restaurant or you go on a vacation and you spend more time looking through the camera lens of your phone to take pictures of your experience because you want everyone else to see it, rather than you seeing that experience with your own eyes for a long period of time. So don't overvalue what the internet and the phones are going to do for you.
Mm.
Okay, you want to see life with your own eyes.
Absolutely.
And physical activity is important too. We used to get together as kids and go just play outside. We never had the internet growing up. And so we go play a ball game or just go outside, take a walk or whatever the case may be. Physical, and you provide gyms at all your locations at Absolute Healthcare.
Yes, we do.
Yeah. That's
So,
such a great
and people
point.
get together.
Yeah.
Seniors whose social lives become more and more isolated as their friends pass away or move away and things like that. They get an opportunity to connect with each other so lovely. and that's I enjoy that. Whenever I'm there, I am getting hugs and cheers and high fives all around.
Oh, that's
So
great.
it's a beautiful feeling.
Yeah, that's a depression beater right there, antidepressant
Absolutely.
medicine right there.
Yes.
Yeah, you
Yeah.
bet. Speaking of medicine, what kind of medicines are available for depression, and what are some things that depression can be confused with?
So I think this is going to go back to the same thing we were talking about before with antidepressants.
Mhm.
They have almost as much stigma as the disease depression does itself. You know, you think that you're labeled as a disease because you take these medicines. These medicines are really no different than any other medicine we provide a patient, just like for their blood pressure or their blood sugar.
Tylenol.
Everything has a possible side effect. Even if you know, drink enough water, you could drown, right?
Right.
We don't just hand out medicines for no reason at all. We have to say, is the benefit of this medicine going to outweigh the risk? And you can call it whatever you want.
Mhm.
If its safety profile is good enough, and if it's indicated, and you haven't been able to get to your goals with lifestyle improvements by itself, then yes, we should try it out. And we know what their side effects are, we know what their benefits are, and we know that most people either don't get side effects, or if they do, we know what to expect if they do. So I don't think that the word antidepressant should deter you from talking about being treated for depression if you have it, because it's not one of those old movies where you see somebody in a straitjacket and it changes your perception of the reality and you can't control it's not like that. You don't have a changed perception, and it takes weeks before you can even really notice a change. But it's almost like when you're losing weight and you don't notice any difference in the mirror right away, but
Things are happening.
you see something, you know, a couple months later down the line, and you go, oh wow, you know, I do feel different and better, look better than I did before.
Yes,
So-
we're talking about these patients who feel so wonderful now. They
Yeah.
were depressed prior to this, like
Yeah.
you were describing, and now they are up and chirpy and wanting to come to the gym and do stuff, get involved.
Yeah.
They look at the mirror, and that's an antidepressant automatically.
Yes.
They feel that I am good looking now. I am what I wanted to be. So it's so important that the medicines start to allow you to enjoy that perception, but it's not medicine alone. There are multiple ways of treating depression. So we want to be much more holistic in terms of treatment. And that stigma, like Dr. Gupta was saying, associated with these medicines, are you on Prozac or what? Yeah, I am. So what? What's your problem? I care to treat myself. I
Right.
care to take care of myself.
Mhm.
And that is why I'm taking Prozac. And I'm proud to do so.
Yeah.
So if it makes me a better person, I want to do that.
Amen.
I want to do that for me and for you, for everybody around me, people I care for, and even people who don't care for me, because I want the world to be a better place.
That's right.
So there is no shame in taking medicines, no matter what your condition, because you are one person who wants to be better.
Yep.
And how can I criticize that?
And you're not obligated to tell anybody what medicines you're on.
Exactly right. Yeah.
That's protected information.
That's
If you
right.
want to share it, if you want to be open about it, by all means, go for it.
Yeah.
But you don't have to do or say anything to anybody at all. The only other person that needs to know is the doctor that's prescribing it to you.
That's why
That's
your
it.
doctor is there, a Hippocratic oath, and you got the HIPAA laws. So,
Yep.
Yeah.
Yes.
Absolutely.
Yeah.
It's just a commitment.
Yeah.
It's a commitment to take your trusted information to the grave with me.
What if it's not treated? What if someone says that no, I don't want to go that route, or I don't see how they would enjoy being in the situation they're in with this disease. But what happens if it's not treated?
What's the question? I can get it. What if the treatment is not provided on time or something?
Or what if they don't want to go that route? What if they don't want to treat their depression?
Many people don't want to treat it, and that's if they are not a harm to themselves, it's fine.
Okay.
But the natural course of depression is that it continues to go down and down and down and down
Wow.
until it might take your mood to the point where you will be self-destructive. So we do not want to touch that point.
Okay.
Earlier we catch it, quicker we can get you back towards normal, more prolonged benefits you're going to get, your performance is going to be better, your environment's going to be better, and everything starts to fit into that puzzle much better. So that's why we want to treat it and not leave it untreated.
Right.
Now treatment could mean medication, could mean psychotherapy, could mean just an app, Could mean, we have some devices that give tiny little electronic stimuli to the brain. There are some magnetic treatments. We currently use magnetic treatments for muscle strengthening. They're used for brain resetting. So all these things are there. And of course, that age-old thing that everybody used to be scared of and thinking of was the ECT, electroconvulsive therapy. I have never seen that being done except for once in my med school 30 years ago.
Mm-hmm.
So one sees that we have evolved in starting the treatment, accepting the treatment, the benefit of the treatment, the comfort of the treatment, everything. So why hesitate? Make yourself better, make the world better.
The biggest risk is not treating your disease, and that's why the Healthy Docs are here. From Absolute Healthcare, 3 locations, by the way, 1 in Spring Hill, 1 in Port Richey, 1 in Tampa. They're here with us every week to bring us this important information. We're talking about depression today. So bipolar disorder, is that the same thing?
So bipolar disorder is often misunderstood in a couple of reasons. One, usually people have the impression that bipolar disorder, they have mood swings multiple times a day. Generally speaking, that is not true. Bipolar disorder is usually having major depressive disorder, like we've been talking about during this episode, but also there are certain times where they go through phases of being overactive, where they're either considered what's called hypomanic or full-blown mania. That distinguishes the types of bipolar disorder. So when we see somebody that has depression, and then, because most often than not, bipolar disorder comes with depression for sometimes months or years before their first episode of being overactive, then we have to consider, is the treatment that they're on the right treatment? Because generally speaking, bipolar disorder should be a mood stabilizer over an antidepressant, because we don't want to put them into that phase of being overactive. And what the meaning of overactive is, I think we should save for a bipolar disorder discussion. But it is a separate disease altogether, but it still comes with depression more often than the overactive phase.
Okay, and also multiple personality disorder is a whole nother issue as well. But we're talking about depression today, and I think we got just enough time to answer the last question here. What can families do to help a family member that may be having bouts of depression?
I think that if someone already has depression and they've opened up to their family, I don't think that it's probably the best idea to say, the good old phases that you've heard growing up of just, hang in there and cheer up and smell the roses and those sorts of things. That it's not going to do anything for anybody. The other thing is, if the patient is already comfortable with opening up to their family about this, then they should be comfortable with just being supportive. Okay, just saying, how can I help? How do you feel today? And allowing them to sort of reflect their feelings and thoughts at you without having to direct what you think is best for them. So just ask open-ended questions. Do you want to talk about stuff? Do you want to tell me how things have been going? Do you think that your treatment is working? Those are the more supportive ways to approach it, rather than trying to say, oh, you don't need any of this. We could do it just by hitting the gym, right? Or eating a better food. Those are those things we do think are important, but we don't want somebody else with too many cooks in the kitchen, right? So be supportive, but don't be the doctor, unless you are one. But even then, you shouldn't be treating your own family.
Amen.
Right.
I agree. From a doctor's mouth, that's Dr. Gupta, Dr. Malhotra in our studio, the Healing Docs, here with us each and every week. So we appreciate the information. We've been talking about depression this morning, and next week we'll pick it up with another issue that you may be dealing with as well. That's why they're here, because they want to give you the best results possible. Remember, live life to its full benefit and get rid of those risks by calling Absolute Healthcare at 352-251-0000. The Absolute Healthcare Doctors, the Healthy Docs, are in our studio each and every week, once again, for you. Any last words? Got 1 minute, gentlemen.
If you recognize it, open up with somebody you can trust, and let somebody who's qualified help you.
It works for me, and I hope it works for you. I know it will. Give it a chance, give it a try, and call Absolute Healthcare today. We'll see you next week on the Healthy Docs show with Absolute Healthcare. Dr. Gupta, Dr. Malhotra, thank you, gentlemen. We'll see you next week.
See you later.
John.
Thank you.
All right.
I phased out for that one question. I was enjoying your answer. It was.
Yeah.
Which one was that?
That was the what happens if you don't treat it.
If you don't
Oh
treat
yeah,
it.
well, I'm just reading right off the list there.